DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm glad you joined us. We have a great show today. Dr. Matt Meisner from Kansas State University is joining us, and we're going to talk about castration. And he's brought some equipment and some models, and we're going to get to it, and we're going to have a great show talking and showing you some of the different techniques.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Closed captioning brought to you by Vet Gun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome to DocTalk. We have our friend, Dr. Matt Meisner, back on the show. Thanks for being here, Dr. Meisner.
Glad to be here.
Folks, Matt has been on the show. He works here as a professor in our livestock services. He's a section head of livestock services here at K-State's College of Veterinary Medicine in the Veterinary Health Center. And today we're going to talk about castration. And Dr. Meisner has brought models and techniques, and I guess we start out by, why and when.
Right. I think that we'd always encourage everybody when it's doable, you got calves to castrate or lambs or goats or whatever you've got, to do it as early as possible, as young as they are, and even some recommendations, if you can, do it before 3 months. First time you get them caught. It's quick, it's swift. It can be a really efficient procedure to get done that early. The longer you wait, the more likely there are for complications, but again, there's sometimes you got to wait till later anyway.
So I tell the students, the longer the testicles are attached to the calf, the more attached the calf is to the testicles, literally and figuratively.
Absolutely, yeah.
So we got to get them done early. But, folks, if you're going out to put a tag in their ear and you know they're going to be a commercial calf, just get it done.
Get it done, yeah. Get it finished.
Yeah, so you have different types of techniques?
Exactly. So then, there's a lot of different methods. And I think when I'm trying to group these things and talk about different methods, one of the things I talk to students and others about is there's these, quote, bloodless type methods that we use, which are band type devices that will actually cut off the blood supply to those. Then there's surgical methods, and surgical methods are going to be certainly opening up the scrotum and removing the testicles manually right then and there.
The one thing, though, that the people should understand is that bloodless does not mean painless.
Exactly.
And bloodless does not mean no complications.
Absolutely, yeah.
And that's why I think sometimes people say, well, I'm going to do this technique because they won't bleed to death, or, and we'll talk about complications.
Exactly, so I prefer certain methods over others, but there are times when I have to adjust for environmental reasons, size reasons, facility reasons, so you've got to adjust, and that's why there's so many different methods for getting this job done.
You bet. Well, Dr. Meisner has brought some, what is in here?
I don't know. I think they're little rubber balls.
So when we come back, we're going to talk about some different demonstrations of castration techniques here with Dr. Meisner, whether it's the size, whether it's the age, weather, different things that go into the Rolodex, all the above. Thanks for watching Doc Talk. We'll be back after these messages.
Hey folks, Dr. Dan here. Welcome to our Cattle First Tip, as sponsored by Behringer Ingelheim Vet Medica. And today we're going to talk about pen floor conditions. Now, when I think about pen floor conditions in confinement, I'm thinking about one of two things. I'm thinking about too muddy or too hot. And specifically, when we talk about mud, we want to be able to control mud. We want to give cattle, we may not be able to control rain and control all the mud, but through building mounds and through making proper ways for water to escape the pens, we can make sure that these pens drain well, and we can make sure that cattle have a dry place to lay down and that they don't have to wade through mud to get to the feed bunk or the water tank or the place that they're going to bed. When it's 97 degrees outside, the pen floor is 137 degrees. So providing some sort of bedding, which is straw, even when pen floors are too hot, can provide comfort for calves to lay down and give them a cooler spot. We don't want pens too muddy. We don't want the pen floors too hot. This is your Cattle First Tip.
When it comes to stopping hornflies, cattlemen love their Vet Gun. Today they love it even more because Vet Gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin VetCaps from AgriLabs.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Meisner. We're talking castration, and I guess let's start out with the bloodless techniques and maybe start out with that baby calf.
I think the most common ones that we would use in a young calf or lamb or whatnot are going to be these small rubber bands in that can fit into these over the scrotum, get released, and then popped out. Harder to do sometimes in a model. And then you leave that little band, which then essentially stops the blood supply to the scrotum and the testicles, and they eventually become avascular and fall off. So they lose the blood supply.
Takes a couple weeks.
It does. It takes some time. Again, those types of situations, there's less bleeding, less open wound to deal with in some areas.
But highly effective in these little guys.
It really is. It really is. Again, it's not without complications. We can group all those in the end of here, but that is a quick, easy, fast method to get the castration stuff.
I do tell the students too, you got to be pretty technical. You got to be able to count to 2.
Absolutely count to 2. This is a very common thing that people miss one, and
Yeah.
we end up having to go back in surgically and find the other one. So that's one.
All right.
Other methods, then you get essentially the same thought process with these different devices using a lot larger bands for these really large testicles, okay? And they can get onto those. Complications, the larger they get, bleeding becomes a concern, and so those types would be another option. One we've got other bands here which are a little handier. This is a California bander. It's a handheld device that gets used, that fits into this slot like such. gets slapped around there and then clipped off here on as well. It's an interesting little device. A lot less cumbersome to use, but definitely benefits. One other bloodless thing that we don't use a lot here in the U.S., but in Europe and South America, is a Burdizo type of a bloodless castration device. And what it does is we clamp this testicle on both sides, opposite the other side, and we offset that. And the goal here with this device is that it's smooth, it cuts off the blood supply, but it doesn't take off the scrotum. And so places where flies, blowflies, and things are a really big problem, it does the same thing as the band, but it doesn't allow a wound. Okay, and so it helps limit some of that fly strike.
There's people that remember clamping and saying we're going away from it. You know, in South America and South Africa, hell, we got veterinarians that are using on dogs.
Yeah.
Let alone calves.
Right.
So.
Yeah. You know, and again, any of these, I guess you kind of lose a technique and lose the people that used to do it. You don't teach it. So we still teach it, and kind of recognizing there's some benefits, pluses and minuses, and to have this as another tool in your box is a good thing to have when you don't want open wounds.
You bet. Well, let's take a break. When we come back, we're going to talk about open castration here with Dr. Matt Meisner here at Kansas State University's College of Veterinary Medicine. Thanks for watching DocTalk. We'll be right back.
I'm Dr. Corey Rava, Chief Scientific Officer with NSO Discoveries, and we had a friend who works for a living on his horse.
I'm Ron O'Neill. I work for a ranch just south of here, not too far.
And two of his horses had some pretty serious injuries. The first one was a laceration to his pastern, his palmar pastern. So for those people who don't know, that's the part of the foot just above the hoof. The laceration was through the skin, through the sheath, exposing the tendons. This is an injury that absolutely can be career-ending. They tried bandaging it up and it just wasn't getting better.
And when the vet don't know what to do, they say, well, yeah, he's probably done.
So I came out with a surgeon from Kansas State University, and we evaluated it and realized the best thing for it was likely going to be platelet-rich plasma. And so we treated it, and that horse made a great recovery.
The healing time was amazing. It was about 3 weeks versus could have been 3 months before he was healed up.
The other horse is also a working horse, a ranch horse, who had navicular disease. And the navicular disease is also a disease of the foot, but it's a developmental disease. It's not a specific injury. And so what happens is the forces that go through the foot cause pain that lead to basically degeneration of a bone. So horses, they tend to walk like they're on eggshells. It's not so much a head bobbing lane, but they're not comfortable. If you go to turn them in tight circles, that's where you notice that they're really quite off. And with this disease, when you turn them to the right, I'm on the right. You turn them to the left, they're usually left lame. We tried some traditional modalities with him originally, and he simply didn't get better. We had a choice of turning him out and crossing our fingers, and we decided, you know what, we're experts in regenerative medicine, and we have some other arrows in our quiver. So in that horse, since it was a more significant injury, we decided to do a combination therapy of stem cells and platelet-rich plasma.
Not every horse is built for cattle, and typically we want the biggest, strongest, toughest kind of horse. It's kind of like buying a Dodge diesel pickup or buying a Ford Focus.
We collected the sample. In this case, we happen to use adipose-derived stem cells. Collected the blood to make PRP. And within a matter of hours, we had the horse treated.
I would recommend Enzo. I've seen it work on dogs, I've seen it work on horses, I've seen it work on humans too. You know, when they start talking about stem cells, this is cutting edge of technology. It really is.
Some call it a come from behind victory, an unlikely win, a reversal of fortune. Snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Matt Meisner, and we're talking about castration. And Dr. Meisner is the head of our livestock services here at K-State in the Veterinary Health Center at the College of Veterinary Medicine. And having 4 daughters, this is a good topic for me to listen and pay attention to. But anyway, we have talked about closed castration. We've talked about why we castrate early. Let's talk a little bit about some of the things that you do or recommend when we do open.
Yeah, so
surgical.
Surgical type castrations would be essentially implying that we're opening the scrotum to pull the testicles out and then removing the testicles separately.
Okay.
Of course, probably most people will remember, we try to take off the bottom half or the scrotum or so with either a scalpel blade or a really sharp knife to let those come out. Another method to get that open is a Newberry type knife, and these are blades that are sharp on the inside. We take those to go across and we pull away. This is a really handy tool. It prevents you from, I have some really great scars on my fingers from pocket knives. You don't have to worry about cutting the calf on the inner part of that leg. So this is a nice tool to have in your back end too. But regardless, we have to get that scrotum open so that we're going to have good drainage afterwards and we can get good exposure to those testicles. And then after that, it's a matter of technique and a plan on how we're going to remove those. Small ones, small calves, quick, we can just strip and pull. We can use a knife to dissect some of that stuff. The little bit bigger ones, we'll use some sort of an emasculator type device to clamp. These not only cut, but they also cause a nice crimp or a crush. So these type devices for a little bit bigger ones. We've also got what we call a Henderson tool. This tool actually attaches to a drill, and we can clamp onto there as well. And then that actually twists that cord until it comes loose and it causes some obstructs blood flow.
This one's pretty good at for bigger calves and well, I mean for all size calves we've used it, but really like it on the big calves and prevent hemorrhage.
It is. It does a great job of it. It's one of those tools I despised when I first heard about it, 15, 20 years ago, but now that I see how to use it and how to avoid getting contamination, it's actually a really effective tool, and I use it quite a bit in larger testicles. On any of those, and again, you hinted to it early on, but in any of these, we're usually using if we can, we're going to use some sort of analgesic, some sort of local block in smaller numbers if we can. Everybody thinks of it surgically, but either one of those would be possible to get rid of those. But anyway, the open ones, again, whatever we do to open the scrotum and get that out, we got to have a good blood hemorrhage control as well as a nice open scrotum so that it drains really well afterwards.
Cool. Well, let's take a break. We've gone over the different techniques. When we come back, talk a little bit about some of the complications that can happen and what maybe we should do if it happens. You're watching DocTalk. Thanks for joining us. We'll be right back after these messages.
You spent countless hours building a strong operation. But when it comes to trichomoniasis, the odds are stacked against you. It takes just one infected bull to take down the whole herd. Damage could include open cows, lost pregnancies, and lost profits. The good news is with TrickGuard, a herd doesn't have to feel like a house of cards.
We work in our business every day. Let's work on our business. This is practical information brought to you by those doing it every day. No theories, no opinions, just real people with real information that do it every day. You want your people to follow you, care for them, love them, be there for them. Tell them you've got their back. It's not about you, it's not about me, it's about our people.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with my friend and colleague, Dr. Matt Meisner. We're here at Kansas State University's College of Veterinary Medicine, where Dr. Meisner is the head of our livestock services. He's a veterinarian. He's boarded in internal medicine.
Yep.
And he does surgeries. He does medicine. He teaches students. He sees cases from all across the United States. People bring him cattle, and to get him to break away from the clinics and come up here is special for all of us. And then to bring such outstanding models so that we can understand exactly. I mean, I've been through a lot of these different demonstrations and things of that nature, and to bring these up and bring the models really kind of drives it home for a lot of us. But it doesn't always go well.
No.
Sometimes, I mean, it's like any surgery, right?
Right, exactly. You know, these models are one thing, and they're great to teach, you know, skills, techniques, ways to move your hands and way to handle instruments. First thing they don't really recreate is the bleeding that goes on with a surgery like this. And so some of these surgical things, probably one of the biggest complications with surgical is hemorrhage. So, and that's not always the phase of the moon. You know, there are some some reasons. I can blame it on that. I don't remember which way it goes, but that's what I blame it on when I have problems. But bleeding's a problem, so we have to be sure we can control that. And we're doing everything we can using different devices to prevent bleeding, okay? I think second, complications would be infection. So it's an open wound. You can get flies, you can get contamination of the environment, you can get mud. That's one reason why we try to prevent that accumulation of that by having a good open drainage for that site. But infection is possible. Some of the bugs that we talked about as far as a complication in the environment, one of those big ones is tetanus.
You bet.
And that can happen with either method, closed or surgical. I've seen it from both of those. Having them vaccinated ahead of time helps limit that. Okay, so if we've got a tetanus or a 7-way on board, we're good. The bloodless devices, or these bands, make that environment a wonderful place for that tetanus bacteria to grow. So it becomes anaerobic.
We definitely recommend, if you're going to use a band, make sure you give a tetanus toxoid at the time of banding, at the minimum.
Absolutely, yeah. So infection, you know, fly strike, bleeding, tetanus in particular are some of the big ones that we think about as potential complications. I've seen swelling, just generalized basic swelling, which goes away.
So when you have a bleeding issue, how do you like to try and solve that problem?
I go against my better judgment almost every time, and a lot of times I'll go back looking for it, knowing that I'm probably not going to find it. But it's nice to look. Sometimes you can see the bleeder, you can clamp it off, you can tie it off. You know, that's another method. You can actually ligate these things. But oftentimes I end up having to just get gauze and pack it tight and wrap it tight for compression, and hope it stops that way. It's sometimes hard to find.
You bet. Well, folks, obviously an expert in this area. Thank you so much for bringing all the different tools up here, sharing your expertise. But work with your local veterinarian, call the university, talk to people about different techniques. We're always doing CE on this and learning something new. and reinventing maybe some of the old things that we used to do.
Yeah, like I say, there's no super one way to do this, and every way has its purpose.
This was a fantastic show. Thanks for joining us today. Remember, if you want to find out what we do on DocTalk, you can find us at www.doctalktv.com. Always work with your local veterinarian. With Dr. Matt Meisner, I'm Dr. Dan Thompson, and we'll see you down the road.
Closed captioning brought to you by Vet Gun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance. From AgriLabs.
For more information about this program or previous programs, go to DocTalkTV.com.
DocTalk was brought to you by Merck Animal Health, the science of healthier animals.